Discover the low back exercise mistakes that are worsening your low back pain and how to correct them for lasting relief. Hey guys, Dr. Christy Ennis. Exercise number 1 is the bird dog, which is on the hands and knees. So if you are following along or want to see how it works, you can do this on a mat or on your bed. But traditionally, we have hands and knees positions with the shoulder stacked over the wrists, and it's an alternating arm and leg, opposite arm and leg. Great exercise for the back overall, especially when it's done correctly. However, here's what I see tend to go wrong. Starting actually with this startup position, a lot of times people don't have that shoulder stacked over those wrists, so they're setting themselves back, which already can put a little bit more strain in through the spine. So once we correct that, then what I see tend to go wrong are 2 positions in the spine. One, people will arch the spine or they'll dip the spine as they go to lift so that it looks either kind of like this or sometimes like this. These are exaggerations. I know you guys aren't doing them that way, but just so you know. So sometimes in order to correct that, we just need to have smaller motion. So you always want to think, right? Keep that belly button gently pulled in. If you need to just start with the leg, that's okay. Sometimes adding that arm in makes it hard to stabilize. So even starting here, if you do add that arm in, you want to think gently squeeze the shoulder blades so you don't hike it on up. And then again, it's okay if you're only lifting a little bit. I oftentimes will have people use another person if you've got one handy, and if not, either a yardstick or a phone right over your low back, as if you twist, that thing's gonna go flying, right? So again, stabilize, right, by gently engaging those abdominal muscles, squeeze those glute muscles, gently, slowly, with control, opposite arm and leg, making sure that everything stays nice and level. Exercise 2 is lying on our back. So again, bed, floor, whatever's comfortable for you. And this is a bridge. So when done properly, this exercise does a great job of helping to strengthen those glutes, which then supports the back. But lots of things can go wrong with this one. The first thing that I usually see is people start with their feet close together. So they have their knees together, and now you tend to work more of that inner thigh and the quad, especially if you have tight hips, because it doesn't allow for that elevation here. So we want to fix that, right, by bringing those feet a little bit wider. The second thing I tend to see, people might start off right, but then they go to lift up and they lift extra high so that they're arching either in through that low back, possibly even the mid back, right? We want our rib cage to stay down too. Then if you could see my neck, my chin is really tucked now and I'm stressing that neck. So you want to lift up as high as you can as far as your body allows, right? That's key. So for me, that's about there, so that now I'm not stressing my neck or any of the other part of my spine, and I can feel those buns kicking in. Also, what can help that a little bit is if you think about just doing a little pelvic tilt so that you're flattening your back just a little bit, trying to hold that position and then lift, you actually get a better engagement of those glutes as well. So nice way to help support there even a little bit more. And then lastly, you can play around with the position of your legs. So sometimes if your legs are really far out, you're getting a lot of hamstring, which is great, but not as much in here. And again, kind of the opposite too. If my feet are really close to my butt, sometimes that's more of the quad. So this is a little bit of an experiment. Like I said, you have to kind of see what feels good for your body, where you can feel like you're pressing evenly through the foot. And usually that's right, just a little bit away so that you don't have exactly a 90-degree angle there. Exercise number 3 is now on our stomachs, even though it looks like I'm taking a nap. We're not. This one is the swimmer, my favorite sport, right? So this is a great one again to strengthen all of these lower back, especially the small lower back ones, and the glute muscles, right? So if done properly, it kind of looks like this. Alternating opposite arm and leg. But where I see this go wrong, similar to the bird dog, and that people really want to lift that leg high, so they arch extra high into that spine. And notice I'm arching, although my back doesn't arch that much, I'm arching extra into that lumbar spine, but also look what I'm doing to my head. And that is totally straining those muscles. You can see I can't even speak well, right, when I do this. So it's okay not to have a lot of motion. Stick with that small motion. So again, not arching the back. You're going to think about squeeze the glutes. That will help prevent that. And also doing a little chin tuck back keeps that neck in a neutral spine. From here, where I see things also go wrong, again, similar to that bird dog, to help people, right, kind of push with that opposite arm and then almost roll. So it looks like I've got really good motion in that leg, but that's cheating again. So just nice, gentle pressure evenly. You don't want to push too hard through the hand that's on the ground. And then lastly, we want to think about that upper part or mid part of the back too. So because we're working some of those stabilizers, sometimes our body wants to cheat a little bit by hiking that shoulder, right? And again, adding that rotation so that it looks like our arm is lifting higher. So, of course, the abs are engaged, our glutes are squeezed, chin is tucked, and now you can just do a very gentle shoulder blades squeeze down towards one another. It doesn't have to be super strong. And then you can go ahead and lift. So now now we are protecting that whole spine. Our next exercise is actually one that I see done wrong pretty much all the time, which is why it's really important to go over. It's the plank. So if we're doing this on our forearms, right, we want to think about having those shoulders stacked, kind of that chin tucked, abs engaged, pushing up and trying to stay in that nice straight line, okay? Now, where I see this go wrong is actually many, many places. This may not all be what you're doing, but just pay attention because some of them might be. Number one is people tend to arch that spine. Again, exaggeration, right? But they tend to arch that spine and then also look forward. Okay, so now I've got my back arched, my neck arched, and this one, even more than the other ones, puts a lot of strain on the spine when that arch is present. Like I can feel that pretty significantly right now. So from here, even if you lift up, then sometimes people overcorrect the head position and then they're looking at their feet to make sure that they're lifted up also. So you want to make sure to help with this, not just lifted right through here, but that you're looking almost at an angle, like a 45-degree angle kind of towards the mat, right? So you'll feel, if your neck feels stressed, then you know that that's not the right way to do it, okay? So here, we got that part down. The other thing I see, right, is those shoulders, kind of like some of the other ones. Let's say you got this part dialed in, but then I see this, right? Those shoulders shrug up, or people really trying to stay nice and flat. So they got the back part, and then they think about squeezing their shoulder blades down to keep the shoulders down, or shoulder blades, I should say, and they let go of that other part. So shoulders are now down, and they go back to that arch. So we want to try to get both of those up. Now, this one too, like I said, I tend to see this one go wrong a lot. So if someone is going to do this, it's not my favorite exercise, and they're just starting out, I'll often have people do it on their knees, and it's easier to control, or even on the wall. Now lastly, even if the form is great for this one, I see people just try to hold and hold and hold and hold and hold forever. Great to hold for a little bit. Once you get beyond 60 seconds, we want to add some functional movement to that because that's kind of how our body works in space, and I'll link a video on that as well.